Thank you, Kelly. Thank you, Rogers. Thank you to the Georgia Public Policy group and team and all of your supporters and members for all you do and your leadership. I do believe that in this wonderful federalist style of government that we have and are blessed to have in this country, that the states really do provide the leadership, and we are really pleased what you're doing not only in healthcare but also on education and so many other issues, transportation. Talk a little bit about where we are in this health reform world. It is one of the things, as we know, that business wants most is just tell us what the rules are going to be. Give us some stability. And this is nothing if not unstable, not only politically, but also with the courts. I mean, I actually had an opportunity. I went to a Reagan alumni celebration last night of President Reagan's 100th birthday celebration, and had a chance to talk with Attorney General Meese, who served as in many capacities, Governor Reagan and President Reagan. And he said that he thinks this may very well be expedited to the Supreme Court, because he said one of the things that appellate courts do is sort of organize a case and go through all the depositions and all of the court documents that have to be sorted through, and that's not the case here. This is really a pure constitutional issue. And very likely, and they very well could be going to the Supreme Court earlier. It's hard for me to believe that they take it in this term, though, because the decision would have to come out before June, and that's very, very fast. So, and especially because this doesn't, actually, most of it doesn't take effect until 2014, although, of course, much of the machinery is getting put into place. So it's very, very uncertain. As you know, the Senate voted on Wednesday night, took their vote, 47 to 51 to repeal the law completely. 2 senators didn't vote. Senator Lieberman of Connecticut, who's retiring, and Senator Warner of Virginia, where I'm from. So it was, relatively close vote. Courts look at that as well. And with the 26 states, and 28 states total, Oklahoma is filing its own suit against Obamacare. Very, very uncertain what's going to happen. And I think, I have a book with 3 of my colleagues coming out in March on the anniversary of the signing of the legislation called Why Obamacare is Wrong for America. And it talks about all of the different, how it's affecting already and how it will affect taxpayers and seniors, families, young adults, people with health problems, you and your constitutional rights, and really show the sweeping impact of this legislation. I think that people have been calmed down a little bit because of the early provisions in the legislation. Oh, if it was really only about having 26-year-olds on your parents' policy, the pre-existing conditions, we're really for that. What was the big deal about? Well, the big deal, and the president keeps saying, people are going to like this more as they learn more about it. And he thinks the only reason we don't like it is that he hasn't explained it well enough to us. How many speeches? What's coming is that we are going to try to cover at least 32 million poor people. A good idea. We could do this through 3 market principles and through free market reforms. 16 million are going to be added to Medicaid. Probably arguably the worst health care program in America. I served for almost 2 years on the Medicaid Commission and got a close-up look at this program. There is hardly a program that is more in need of reform to avoid the waste and the abuse. It's got a long list of very generous benefits, and almost no one can find a private physician, except relatively few, to see them. So that's why they go to hospital emergency rooms, the most expensive place for care. But since they're mandated to treat people that come there, then we wind up paying the bill. This program was desperately in need of reform. And instead, they just added 16 million more people to it. 16 additional million people are going to get some new subsidies through the health insurance exchanges. My colleague, Doug Holt-Dakin, who served as director of the Congressional Budget Office in the earlier part of the last decade, said that he believes that as many as 35 million more people are going to wind up in the exchange with additional subsidies, and therefore cost an additional $1 trillion for this program that the government didn't budget. On top of that, when you look at the 10-year spending of this the first 10 years of spending, they're already $1 trillion over what they budgeted, because as we know, they have 6 years of spending and 10 years of taxes. Well, when you finally catch up with that, then you're gonna wind up with a program that's $2 trillion over expectations in the first year. And that doesn't even talk about what it's going to do to the states, or the $500 billion that's going to come out of Medicare. And we're going to make the Medicare program stronger by taking $500 billion out of it. Seniors are not buying that, as they should not. The House Budget Committee invited the chief actuary for Medicare to testify before the Congress last week, and said, Rick Foster, who is a straight shooter if ever there was one, who works for the administration, I think he's got to make sure that somebody else starts his car for him in the morning. They said very directly, will this law reduce costs? Is it true when the president and the administration said this law will reduce costs? He says that statement is false more so than true. And then they said, will everybody be able to keep the coverage they have now as promised? And he basically said no. So here you have the chief actuary. Then at another hearing the same day, they bring the guy up from the OMB, Googlesly, who is head of sort of sorting through all the regulations that the administration's proposing. They put a regulation through the end of November, 600 and some pages of regulation to implement parts of the Medicare Medicare changes. And somebody slipped in there the provision that caused such an uproar in 2009 over death panels. And then the administration had to take it out when it wound up on the front page of the New York Times, Sunday New York Times, with Robert Pear writing that Blumenthal, is that how I say his name? The Democratic congressman from Oregon who worked to get that back in there after it was taken out of the legislation. And the head guy of regulation at OMB said, I don't know how it got in there. Then they have another person from the administration testifying. On one side, the administration saying this is not a tax, the individual mandate. And on the other side, in courts, they're saying it is a tax to try to make it constitutional. Which is it? And he was it turned into a pretzel trying to answer those questions. So it's going to raise taxes by $1 trillion at least. It's going to increase the deficit by $2 trillion in the first 10 years over the expectations. Millions of people are going to lose the coverage they have now. And an analyst from McKinsey & Company said she believes that 80 to 100 million people are likely to lose the coverage that they have now. Not that they're not going to get other coverage, but they're not going to be able to keep the coverage they have now. So many promises are being broken. I do not have a crystal ball of knowing how this is going to turn out, but I will tell you that the American people absolutely are so strongly opposed to this legislation and to what it's going to do. The more they find out about it, the more opposed they are going to be. And I believe there will be major changes, whether or not it's thrown out in the courts or whether or not the American people elect a new president who will sign legislation to repeal it, and a new Congress, a Senate that would get this legislation through. One way or the other, this is going to be dramatically changed, if not repealed. But in the process, states do have to do a lot of things and can do a lot of things to begin to prepare for the right kind of reform. And maybe we can talk about that during the Q&A session. Thank you all very much.